I'm joined today by Dr. Caroline Marlow. And Caroline is a pain psychologist, but she's actually a sports and exercise psychologist with a pain psychology background. And the reason I asked her on here is I just get the idea people don't understand how pain psychology and sports psychology can actually speed up their recovery from injuries. And the problem, as soon as you say the word psychology, and sorry, Caroline, it is what people think. They think, ooh, that sounds a bit woolly. And I'm a strong person, I don't need it. But we've seen such good results with people getting support in that area that today's video, I want us to really dig into what it is you do, what you do, how you help people, what the typical person is you can help. And we're going to use practical examples and just discuss cases that Caroline has actually treated or examples of those cases that you can get an idea of whether she can help or not, or somebody similar to her can help. Thank you so much for agreeing to this. And just tell us a bit about yourself.
Thank you so much, Maryke. Obviously, it's an absolute pleasure to talk to you once again. So yeah, as you said, basically, I've been a sports psychologist for a long time, longer than I choose to admit. And within that, I've worked with elite teams all the way through to weekend warriors. As a sports psychology consultant, I was a lecturer. I suppose that's my main thing. I was a sports psychology lecturer for a long time, taught master's students, undergrad students, supervised PhDs. And then I left lecturing and kind of had a bit of a well-being business for a while, very much looking at well-being and performance, different to what most people think in terms of well-being, but like helping people to feel confident, competent, valued in the workplace, those kind of things. And then I was asked if I could do pain psychology. And I initially said, well, no, I can't do that. But then I looked at it and I thought, actually, I really can. And it's absolutely fascinating. So I think from a sports psychology background, I mean, you've just said there how psychology just kind of puts people off. But I remember, like, when I first started doing sports psychology back in the 1990s, it literally was, and please, this phrase is from the 1990s, the loony ones who would go and see the sports psychologist. Whereas now, so many of the elite guys have sports psychologists. So many people looking for support from sports psychology. Sports psychology is going into business and those other fields. So sports psychology has become really mainstream now and really valued. And I think that pain psychology really needs to go the same way. And increasingly now, like I'm kind of meeting like really top pain consultants who are really realizing now that pain psychology has to be part of the deal. So I found it absolutely fascinating. As a psychologist, it didn't occur to me that psychology could be involved in helping. And I suppose I gave up sport when I was from an injury when I was in my early 20s. And then I had back pain in my early 40s. And someone said to me, oh, there's nothing wrong with you, which of course drove you crazy because why was it hurting if there was nothing wrong? So I kind of thought, yeah, this is actually something which I know is really needed from my experience. And then you just see the huge numbers of people who have pain. And particularly when I hear of young people, sporty people with pain, it drives you around the bend because I just know how much it affects their lives. And I know what a difference we can make. It's extraordinary. Pain psychology is a psychology of what happens within everybody. It's very normal. It's not as if there's anything wrong with you, something psychologically wrong with you. It doesn't give weakness or anything like it. It's a totally normal psychology. And I think
that, sorry, if I can interrupt you there, that is actually a really important thing to realize. And I want people to really hear that. It's like, it doesn't matter how strong you are as a person. The pain psychology bit is not necessarily a mental thing. It is how our pain systems work. A big part of that is how the pain system works and operates to protect you. So this is not something that you're prone to depression or you're prone to, of course, those things can fit into it. But if you get pain or you have an injury, there is some element of this that is going to affect you. It just varies from person to person how much.
Yeah, and absolutely. And there's no rhyme nor reason, in one sense. But no, sport people, for example, the more you're involved in sport, if you have injury or pain, well, then obviously it's more likely to affect you because it's taking you away from what you do in your day-to-day life, let alone the mental health benefits you get from your sport and the social benefits. So really, it can be totally the opposite. It can actually be that, the mental side of pain comes into it more because your life is so important to you and because you're so passionate about your sport and all those kind of things. But no, it's just a really kind of natural. Essentially, our brains and our bodies are connected. And over the last 400 years in our medical systems, we've pulled the two apart. And we look at injury and pain as purely a physical thing. But the pain science of the last 25 years has totally shown that not to be the case. And it's totally shown that basically pain is a result of our brain and body working together. And as you said, you mentioned the word to protect. That's exactly what it is. It's there to protect us. So I think one really common experience of this, which most people will be familiar with, is the fight and flight response. Well, this response is actually kind of really key to feeling pain anyway. So I expect most of us would have had a time when, I don't know, maybe you're performing at a really high level competition, or, you had a presentation at work, or you were nervous about something, and your body starts to change. Your heart rate goes faster, your breathing rate goes faster, your vision narrows. And that's not because your muscles and your eyes have suddenly decided, oh, let's change. People would say, well, this fight and flight response is because my brain is worried about something. I'm worried that it's going to go well. I'm worried I'm going to let myself down. I'm worried about what the outcome is going to be. And that's what starts off the process. And it's exactly the same with pain. Our brain, consciously or subconsciously, thinks there's a danger out there. So it could be, yes, you have snapped a tendon. It could be because you've been sitting down too long. It could be because the doctor's told you you've got something which sounds really scary. And those are the things which your brain will pick up on. And then it makes changes in your system, exactly as in the fight and flight syndrome. It makes response. It changes your system so that you do become more sensitive around those areas, and you do produce inflammation. And these are the things which create pain. So it's all about, just with fight and flight, the perception of danger and how your brain then asks your body to respond to that, to protect you, to keep you safe.
Yeah, and I think it's also worth saying here, because often people walk around or walk away from chats like this thinking that, well, you're telling me my pain is all in my brain, but I know it's not. I've got an injury. If I'm going to try and push through it, it's going to get worse. So yes, of course, pain can be linked to injury, but that pain can be dialed up or dialed down depending on what else is going on in the system.
Absolutely, absolutely. So earlier on, we kind of made a very clear distinction between pain psychology being a normal psychology. But yes, we know that trauma, we know that depression, people who have those situations are more likely to have pain. But yeah, generally, the brain is a wonderful part of this, because it gives us a way of helping pain and treating pain and dialing down the pain, which is really accessible to everybody. You don't need meds, you don't need surgery, you don't need injections. I would certainly recommend a damn good physio, because we love them. But
I didn't pay her to say that, but
no, you really didn't. But seriously, I mean, we talk about medicine cabinet in the brain, because the brain gives us the solution, in terms of helping us. So the brain is the solution to pain. It's not the thing to be scared of involved in it. And it's amazing the way that it works.
So maybe let's jump in and give us an example. For instance, I know you've got a case that we discussed about somebody who actually tore their anterior cruciate ligament, their ACL. So we're going to discuss acute case of somebody who's got an acute injury, but we're also going to look at chronic or persistent pain later on. So, and it's funny because I always assume that pain psychology is more useful for the more chronic ongoing cases, but you have totally convinced me that no, actually, it can be just as important for the acute cases. So yeah, let's dig in and see some examples of that.
Yeah, I mean, overwhelmingly, people who come to see me do have chronic pain, but they're the ones who are more desperate and kind of run out of options. But yeah, acute pain, it really kind of works as well. So yes, what started our discussion a while ago was when I had a lovely young lady called Jess who ruptured her ACL playing football. So bless her, she had a ruptured ACL, a grade 2 medial cruciate ligament sprain, bone bruising, potentially meniscus tear as well. So she'd been having physio, tissue manipulation, but she was still unable to walk, and she was still unable to straighten her knee. And she had to be able to straighten her knee for her to have the ACL reconstruction. And that was crucial if she was to return to sport, which, let's face it, is not everybody wants to do. So talking to Jess, she had good days and bad days. And she found the pain was worse on the days most difficult when she was on her own, particularly when she was at home on her own. And because she was injured, she couldn't get into work, so she was working from home. So there's a situation which I think is kind of common to many people, where life changes and they become more isolated because of her pain. And obviously that has a kind of emotional kind of response as well. Jess was also adverse to pain. So, and she knew that there was lots of pain coming her way. So she kind of wanted to find out a way with dealing with that. And also, as I said, her key aim was to get back to sport, because it was really important for her to do that. And a number of people who I see who kind of say, yeah, okay, everyone talks about the physical aspects of sport, but actually the thing that I'm really missing is how not doing sport is affecting my mental health. I'm just not me. I'm just not chirpy anymore. So, and this was a kind of a classic example of this with Jess, really. So what I always do when I kind of start to work with people is we look at how pain works. We look at this brain and body kind of connection I talked about with you. And of course, we apply it to her situation. So within that, we kind of looked at the fact that she was fearful of moving her knee. She didn't want to hurt it anymore. So this is, again, is a really kind of common concern that people have. She was very aware that when she walked, her leg buckled, and she actually expected it to buckle, which is interesting as well. Okay. She was starting to anticipate and expect, well, then again, obviously that's the fear, and that's going to kind of grow. But overall, she was stopping moving.
Okay.
And one of the key things I say to people is you've got to keep moving. Of course, that's banging the world of the physios.
So maybe just if we can do a quick gear to it, why would being afraid of movement and anticipating those things impact her pain?
Okay, we kind of get into the science of it, really. But as I said, this is where if we have that fear, this is where the brain is going to be setting off the nervous system. It's going to be the sympathetic nervous system. It's going to be releasing chemicals into the area, which is going to be making the nerve endings more sensitive. It's going to be increasing inflammation, which then is going to be making those more sensitive nerves.
Yeah.
So this kind of creates more messages to go up to the brain to say that actually there's danger here. And so we go round and round in a cycle. Yeah. So that's the briefest version of all time of how it works. But essentially, it's the fear of movement will create physical changes, which will then mean the brain gets more messages that something's wrong. Exactly. And that's when it creates more pain. And then you end up in this vicious circle that so many people unfortunately get caught in. I hope that wasn't too complex. Was that okay?
No, that is perfect. Yes. Because I feel it's important that people understand there's always the two extremes. There's being really frightened and terrified of moving can be the issue. And sometimes us physios are to blame for that because we're so busy and we forget that there's a person behind here that we give them exercises and things that actually terrifies them. And there's no use in trying an exercise that terrifies you or an activity that terrifies you because it will just make everything feel worse and your pain worse. So getting that right in the middle where you actually feel a little bit nervous, but you're not terrified is the good place to go.
Yeah. I mean, and I'll probably mention this later, but that's one of the things I kind of do a lot with people really is to talk through the sensations which are okay to have when
exactly
kind of when they so we call that it's okay to be in discomfort, but you don't want to go into pain. You don't want to take yourself to the point where you flared up, where it's really hurting for a day or so, where you're diving for the medicine cabinet, that kind of stuff. So so a lot of what I do is about creating safe movement. So taking people really back to the bit where they're comfortable to do, and then we kind of do very graded exercise. I suppose the difference is I probably because I'm having these discussions around about fear more than a physio is possibly able to have, or let's face it, people don't expect to have those conversations with you either. I can have those conversations with people more and kind of really look at kind of what's going on with their movement.
Yes. So what else was involved with Jess's case?
Well, she was also having these memories of the accident, so which ruptured her ACL. So of course that's another big fear. So, and this again is something you kind of hear people kind of saying that whenever they see something which reminds them of the accident, some people stop watching sport because stop watching football, for example, because they see players getting injured and it reminds them of their own injury. So she had a very vivid imagery of what happened. the details you described it in was phenomenal. You know, how it sounded, how the leg looked, the reactions of everybody around her. So she had this real kind of big image of this was a really nasty accident. And everyone was really worried around me. So that kind of comes into it. She found physio really stressful. But she knew that it was going to hurt, and she perceived that she couldn't cope with that. And then that, and of course, all her life frustrations. So all these kind of pile into creating her brain thinking, oh my goodness, there's a lot of danger going on here. This isn't kind of good. So by talking through the pain science, we can see, as I just said, how all these thoughts can kind of come through to kind of create pain. But of course, the great thing is then, once we've identified all these, we've then got things that we can chip away at and change. So as you just kind of talked about there in terms of, well, what can we do about helping you to move? We can do that kind of thing. But also, you know, I kind of spent quite a bit of time with her talking about, you know, what can you do when you go to the physio? You know, what can you do to kind of that? Those nasty physios. So we talked about, I mean, I can talk about this a little bit more later on if you want to, breathing. Breathing was something which she said that she was doing. And we all breathe, of course we do. But breathing is really important because it kind of puts that brake onto our fight and flight response, essentially. So we talked a lot about breathing and how she could use deep breathing, how she can use that within the physio environment. We talked about distraction. Because, you know, if you're distracting yourself, your brain can't be thinking about two things at the same time. So distraction is really important. And also just the kind of things that she could say to herself before going into the physio. Instead of thinking, oh, my goodness, this is going to be painful. I'm hating that. I want it to be over. What else could she think which is kind of more constructive? And of course, everyone will have their own responses to that. So those are kind of the initial things we did. And then after the first session where I just explained things to her, she came back to me and she said, I walked up the stairs for the first time, one step over the other step, straight after your session. Because suddenly she thought, hang on, I can control this. I have another option of the way to think about it and move it. And I'm not damaging my leg when I do it. So instantly, literally said, as soon as I turned the computer off from you, I went and I walked up the stairs.
That's amazing. Yeah. And it's you know what, I've actually got an example of that to an extent as well that I remember now. I remember having to see, when I was still working in a physical clinic, I was having to see a patient of one of my colleagues. And as this person walked in, I thought, this person's notes must be wrong because this does not look like the person that's written on the paper. So I very diplomatically asked the questions, you know, a few questions to the patients. I can't tell him that, listen, I think your notes are written wrong. So, and then it turns out, no, the notes were correct. He did have a foot that didn't work and everything last time, but literally as he walked out the front door in the clinic, his foot started working normally as he walked to the car. Now, we all know that's not possible. We do not have magic wands. But it turned out that what happened was he had been seeing a physio in the National Health System for months and months and months, but the person never touched him to assess him and never properly showed the exercises and things to him. And because they hadn't touched him, in his mind, they hadn't looked at him properly and addressed him. And I looked at it, the exercises they gave him was spot on. There was nothing wrong with that. But his mind and his belief stopped him from actually making the progress. The stuff my colleague did, of course, I just repeated that exactly in the session because it worked. I did a bit of pressing around, did some dry needling. None of that would have the effect he had. And he cancelled his next appointment because he didn't have any need for it anymore.
Yeah.
So, yeah, that's the same thing that you mentioned there.
Exactly. I mean, so there is to say it's the belief that he was being looked after and given something which was going to work, which we didn't have in the first place. Absolutely.
Exactly.
And just, you know, I mean, that's a great example of belief. And the one thing that I kind of get really frustrated about is how hope gets lost. You know, I see so many people who have been, as indeed my example of chronic painers, who've been through medical systems. They've had scans and ultrasounds and x-rays and injections and this test and that test, and they in their mind have tried everything and hope has gone. And yet we know that the biggest and I've done a video on this for you before, Maryke, the biggest predictor of recovery is recovery expectations.
Yeah.
So, it's so key that people have hope, as I think anyone can know from any circumstance
Exactly.
in life. So I think to kind of show people a different way to as you say, to kind of fit in with what people's expectations are in terms of what they can get from physio makes a big difference. Absolutely.
Sorry, I rudely interrupted you with my story.
That's okay. We love stories. So even after the first session, she kind of talks like she switched perspective. And kind of big kind of gains were kind of made after that. So yes, we certainly talked about how to move more safely, and it's a breathing, and she was into the idea of meditation. So often people kind of come to me with skills that they've already got, but they just don't realize they're applying the situation. So that's often how we can turn things around quite quickly, just with little tweaks, just to kind of making people use things more strategically. So and we kind of looked as well about how she can get more safety into her life. So the things which made her feel safe, the things which gave her positive emotions, because that again, that's going to help us. And again, we got those into her life. So it's really, really simple stuff. And often you're saying to people, hey, go and do the things you love as much as you can, obviously, depending on how you're restricted. But people can always do something to give themselves that lift. So that was the second session. Then I didn't see her for a while because she was making great progress, and she actually had her ACL reconstruction. So she managed to get her leg straight as she needed to. And obviously the physio was involved with that as well. I'm not claiming everything. So I saw her one more time after that. And it's basically, she said in that session that what we had done had helped her be brave after the surgery. It helped her understand the pain that she was in and what she could do and what she couldn't do, and how to kind of have to stay positive and relaxed. But what she wanted help with then, and this is classic sports world, is confidence to return to sport.
Yes, especially with the ACL as you going back to sport that pivots. Yes,
exactly. You think that's exactly was the next thing that she wanted to do, is getting her head around being able to pivot again. So basically she'd read in a sports psychology book about imagery. So great, bang into my call. Well, let's talk about imagery. So I told her what imagery was. I helped her develop the skills, and then we just kind of developed 3 really simple images that she could use. So one was like a motivational one, and that was just her remembering herself playing football. When you play sport, you just all have those moments where everything just comes together and it feels great.
Yeah.
So we kind of had an image of that, because that's always a good one to kind of give you a bit of a lift.
Yeah.
But then we also looked, as you said there, at the next phase of the rehab. So what's the safest way that we could think about doing that change in direction? Well, forget doing it out on the pitch. We're going to start off by doing it as you would in physio, on a flat gym floor, space around you, all these kind of things. So we created a safe environment for her to imagine doing this, to give her the confidence to then actually start to do it. And again, we've had research for years in sports psychology, which says that when we imagine things, it actually sets off the same neural pathways as it would were we to move, just not strong enough to make us move. So imagery really helps. And then the third image we did was then helping her just to think about a smooth running action again, but on uneven ground. And she went away with those 3 images, but obviously she then had the idea of how she could change those images and apply them as she wanted at various stages. And that was that. That's the last session we did. We did 3 sessions from stuck from physio, from being able to straighten her leg as she needed to for the reconstruction, to progressing on and having that wonderful belief that she could return to sport again. Just needed to make some tweaks.
Yeah. But I the thing that I want to come back to here is that with pain psychology, there's so much research into everything that can dial the pain up, and it all hangs around all the negative emotions, like fear, if you're very angry about stuff, sadness, stress, all of those things. But the thing that stood out from what you said was we were looking for things that could create positive emotions, positive feelings.
Yeah.
And that's, I don't know why it's never occurred to me like that, but that is essentially what fixes it. Is if all the negative things dials it up, of course everything that's positive that makes you feel happy is going to bring it down.
It's exactly the same as with our fight and flight response. So everyone normally does something to try and cope with it. I will always remember the very first time I lectured to a bunch of 100 plus first years. I literally walked out of that room and thought, it's okay, I'm still alive. Thought that afterwards, and I became friends. There's an older student in the lecture room who I became good friends with, and he said, "You literally shook the entire way through that lecture, didn't you?" And I really, really did. But that's the kind of thinking that you do. I was safe. It was okay. Next time it can be different, and it's the same. It's the same kind of thing with pain. What thinking can we do to make things safe? Even simple things. Most people would know that a hot water bottle helps.
Yes. Yes.
So if that's just giving you a time where your brain can relax, not worry about pain, let's do that. And let's not leave it until you're in absolute agony. Let's do it at the beginning. So
Yeah.
it's things like that, because all you just wanted, the more the brain is thinking about pain, occupied about pain, the more it's going to be worried. The more we can take it away, give it relief, give it distraction, well, then the more we're building up those safeties. So yeah, literally anything, whether it's listening to comedies, podcasts, chatting to friends, whatever gives you that lift that's when people say to me, "Oh yeah, I don't notice it that much when I'm with my friends." You always hear that.
Yes.
So
yeah, exactly.
Be with your friends a bit more than what do you do?
And that's also the interesting thing about when you start saying to somebody, keep a pain diary. Yeah, but it always hurts. I'm like, just do me a favor, keep a pain diary. And then they come back with a massive smile going, actually, it's not always sore. It's painful at these times, but it's so annoying that it feels it's all my brain remembers.
Yeah.
And then it gets, okay, fine. So it's not always painful. So it means we can definitely get out of this.
That to me is one of the biggest arguments against it just being about tissue damage.
Yeah. Exactly. Exactly.
How could it be that there's something, because your ligament, your tendon is not going to change within those seconds and then change back again half an hour later. So that to me is the great example of why we know there's something else going on than just the tissue itself being hurt.
Exactly. So I think I really, really, for myself, want to hear how you teach breathing exercises and things, but let's leave that till the end and first listen to the example of somebody who's had persistent pain, ongoing pain.
So I love all my clients, but I really love this one. This was a young man called Dan who he was a cross-country runner and lived a really active life. He was in his early 30s. But for 8 years previously, so when he was in his early 20s, he got an occasional back pain, which started to spread down his leg, and then it started to go from his neck to his shoulder. And then 3 years after that, his running kind of started to curtail, and even running for a mile, it would hurt. And then 3 years before I saw him, he stopped running altogether. So this is a young man who, at the age of 22 to 30, saw all his sport, all his activity kind of go down the pan. And life was becoming increasingly limited. So he was the example I said, he'd had all the investigations under the sun. He's seen so many different kinds of health professionals. And he was just coming back to, right, I want to get this cracked. Having kind of sit down, thought, there's no way out of this. He thought, no, I want to have another go. He'd been seeing a physio for 4 months, but wasn't moving forward. So what was going on? And the reason he came to me is because he knew that it was affecting his mental health. He knew it was getting him down. So he came to me thinking I was going to help him cope with the emotions of it, which of course I do. But also I want to crack the pain as well, because we can do that.
Yeah.
So his aim. So basically, he was saying he wanted answers, and it's a classic kind of thing that people say: "Why me?
Yeah.
Why is he getting out of control? What's wrong with me? I'm just seeing increasingly parts of my body get taken over by pain. There must be something really wrong. Why can't someone tell me what it is?" And that's scary.
Exactly.
That is scary for anyone. And to see yourself deteriorate. I mean, he was still going to work. He was still active. And I've seen people who are in far worse situations than him, unfortunately. But, that shouldn't be his life.
Exactly.
So he just wanted to know where to start. Okay, so what do I do about this? So again, we kind of talk about, how the mind and the body came into it. And he realized that he is constantly on high alert. And a number of people who say to me, the first thing I do in the morning is think, does it hurt?
Ah.
So they're checking to see all the time wherever it hurts. And of course, then they're giving it attention and then they're more likely to feel it. So he was really aware that he was highly on high alert for all the time. He was really aware of how it was affecting his mood, but likewise how life stress affected on it. Because remember, your brain doesn't, your fight and flight response doesn't know the difference between what's causing it, whether it be pain, whether it be stuff going on in life. So he was really kind of aware of that as well. And so, obviously talking through his system, he started to realize, actually, I can see now how it all kind of comes together. I'm starting to understand my pain. And again, he kind of started to make changes kind of quite quickly. So in the next session, we talked about chronic pain more specifically, and how chronic pain is where your body adapts to be super good at protecting you and super good at creating pain. So, excuse me, but I don't get. There you go. So we start to, and again, by understanding that basically your body becomes like what we call the faulty alarm system, and that's where we can explain and why pain spreads, as your whole body becomes increasingly sensitized, and you can often get more nerve cells put into the area.
Yes, I was just going to say, just give an idea, because you and I know what we're talking about when we say the body can get sensitized, but what are those physical changes that actually happens?
Well, what the person will probably, obviously they'll feel more pain, but obviously also you hear people talk about different sensations as well. So sometimes things feel change in temperature. Some people say they can only really feel cold. Some people say that they're hot all the time. Sometimes skin will kind of get different color as well. Basically, what sensitization means is that your body's on high alert, that you've got more nerve cells, which are really desperate to kind of pick up any information it can of any changes which are kind of going on within your body.
At this point, it's important to understand, we've spoken a lot about how the thoughts and feelings can make pain feel worse in the brain. But these changes we're talking about now is actually physical changes in the tissue. So you're getting more of those little nerve endings. They trigger off more quickly. And when they trigger, they send a lot more signals to the brain. And then the brain has lowered its threshold for what it reacts to. So now, where before you had to kind of hit your thumb with a hammer for it to hurt, once it's hit with a hammer, you just have to press it very lightly and it hurts like mad. So that's kind of how it works.
Yeah, that's great, Maryke. Absolutely. And so the sensitization spreads because basically, if your hand side is hurting, well, maybe there's something going on with your right hand side as well. So we kind of put some more kind of nerves over there again to make sure that you're okay. So pain can spread. There's other explanations for it as well, but again, we can explain why pain spreads. And again, the solutions are the same.
Yeah.
All right. So realizing that there's a reason why pain spreads and realizing that we can do something about them is a massive relief, because until this moment in time, nobody has told him why the pain was getting worse.
Yeah, and your natural inclination is, well, if it's hurting in more places, it must mean that whatever this mystery thing is that they can't find wrong with me is actually getting worse. So where's this going to end? Am I going to end up in a wheelchair or something? Is what people sometimes say.
Exactly. And I think this is one of the kind of the big things about, I think you tend to think that more when people have diagnoses. When you have a diagnosis, you automatically think, oh, well, that is what's now going to happen to me. But the flip side of that is, for people who don't have diagnosis or explanations, it's even more concerning because the pain is still there. And unfortunately, that's where our systems aren't very good. They kind of, our system will pop up and say, oh, well, it's not this. Off you go back into the line again, or off you drop off the system or whatever. But we can, but it's simple to explain in terms of, why pain spreads, and therefore we can therefore get rid of it for the same kind of reasons. So this was a massive relief for him, and it kind of stops all those worries you just said. It makes you think, well, actually, I can do something about it. The way I've seen my past going doesn't have to be my future. And that is a massive weight off for anybody who has pain, knowing that, as I said earlier, hope is one of the kind of biggest things, really.
Yeah, so I should also say, I made it very clear that these are physical changes, but these physical changes can revert again. They don't stay permanent.
Yeah, yes. No, I'm so glad you said that, Maryke, because that is the absolute key thing. Our brains, our bodies are constantly changing. We have up to a few years ago, people thought, once you had your brain cells by the age of 18, that was it. They're constantly changing. Your body is constantly changing. We know that the tiny nerve endings can die in 3 days. So when
wow,
more nerve endings being put into an area to protect us, they can die in 3 days. So the body that I started with when we started this conversation is now changed. Like anything. So absolutely, everything within us can change. All the changes which take us to pain, we can change them all back and bring us away from pain as well. And that's why I hate it when people say, oh, we'll just have to live with it. Or let's help you accept pain, which is something a lot of psychologists do. I see a role for it, but I don't think we need to do that. I think we can reverse it and change it.
Brilliant. So where did you leave him? How did this path
What
work?
happened? Well, first session, he came back to me and said, Caroline, I want to go back to running. I got a race in 4 months' time. What do you think? And I just laughed. And I said, brilliant, Dad, let's do this. And again, it just showed how that kind of way of thinking was changed. We talked about lots of things. We talked about how it upset him, how his friends didn't understand the pain, and how he was having to withdraw from being with them because they expected him to be able to do stuff that he couldn't or couldn't do at the consequence thereafter. Again, we talked a lot about moving. We talked about moving safely. And we also talked, he came back one day, exactly as you've just said, and said, I've been looking back and in my head for the last 8 years, I haven't been able to do much, but actually there was times when I did. So exactly as you said, we started to do a journal, but focusing on the stuff that he could do. And focusing on daily successes. And I think that's a real kind of key kind of thing. So yeah, we had lots of different kind of chats. And I think this is one of the things I love about pain psychology is that I always have set things I want to do with people. I want them to understand pain. I want to get them moving more. I want to get them thinking differently. But they always come with their own questions and their own solutions. And once you get talking about it, it's great. So basically we also kind of talked about how if he was to start training, if he was to do the race, how he could think about it differently. And instead of going on and expecting it to hurt, again, what are the safeties in his environment? What are the things he loves about running? Because let's face it, people do sport because they love it, right? Connected him back to that. And so he kind of took that on kind of board and went training. And then he got in touch with me and said, can I just have a chat? Of course you can. He did it and he loved it. And we then had another chat about him continuing back to his racing and to improve his ranking once again. But yeah, it's that brain shift. It's helping people to realize that what pain is, the mind body connection, and that it can all change. And then that from there, it's just cute details of what we can do to get it going back in the right direction.
Something that I think a lot of people can do with is understanding how you taught Jess to use breathing as well as distraction for the physio session. Because let's face it, physio can hurt. And sometimes, especially if you've had surgery or something like that, it's not pleasant to have physio, especially after knee replacement and things like that. So what was the practicalities of saying use breathing while you're on the physio?
Okay, well, so breathing is a skill, all right? Doesn't mean to say it's hard to learn, but it's something you need to kind of give a little bit of time to. And the more you give a little bit of time to it, the better you will come at it. So basically, when we are, often we just do it generally, but particularly if we're stressed or nervous, we can kind of do short, fast breaths, which are kind of come from our chest. So the first thing we need to do is to get breathing from our stomach. So what I often get people to do is just to sit or lie down, put their hand on their stomach, and then just literally, as they breathe in, does their stomach go out or does their stomach go in? So as they breathe in, the stomach should go out.
Okay. Yeah.
Well, that's the first stage. Just get used to breathing with your stomach going out. And if you're doing that, what's happened is your diaphragm is pushing down to get a lot more air into your lungs. And obviously that air can then go around your body to do good things. So that's my very first step, is get people to breathe from their stomachs first. And then after that, I basically just say, just try and think of either just the breath or just try and think of your hand and your stomach. So you've got kind of something quite physical to do. And then just notice it. And then just see if you can make it a little bit slower, a little bit more controlled. And just if someone can do that just for 1 minute or for 2 minutes of a day, they'll just get used to that kind of routine. So it doesn't need to be complex poses. It doesn't need to be thinking of different things. It's just that very simple stomach breathing and then just focusing on it becoming calmer and more controlled. And again, there's kind of various things that we can do to help with that as well. But is that okay, Maryke? Is that enough?
It is. Yes, absolutely. Absolutely. So if somebody did that, could it be particularly useful then before they go into the session for physio? So like, for instance, half an hour before you leave the house.
Yeah, absolutely. I mean, as I say, if you get good at it, you can bring in that relaxation response a lot faster. So here's again something we do with athletes. So we're not going to get an athlete to kind of, if an athlete's just about to go and run, it depends on the athlete. Some athletes might like this. Generally, we're not going to get an athlete to kind of lie down. No, just before they kind of go into the starting blocks kind of scenario. But what we can do, if they get used to that, they can stand on the blocks and they can just do that one big breath. And it's a long way to being there. So so people can just certainly do this. If they're in the car, and they're just parked up, get there a couple of minutes earlier, or if you're on the train, get there a couple of minutes earlier, or obviously your people are online. Just do deep breathing a couple of minutes more so. And then if when you're in the physio, there's nothing stopping you from saying, "Hang on a second, I just need to breathe out before you kind of do that." Or just focus on it. And the physio can even kind of notice that they're doing it and kind of get into their rhythm or something as well.
And something else to know is you can absolutely tell your physio if you're frightened of something or if you don't want. Honestly, if you tell me that you're really terrified of something, I would immediately change it because I know that it's not going to be useful. So don't think you've got to grin and bear things and be brave. That's nonsense. It's got to be adapted to something you can actually cope with.
Yeah. And can I just tell you something, Maryke? I know this breathing absolutely works because I broke my fibula at Christmas, as you know. So the fibula, for those of you who don't know, is the little bone which kind of goes down in your lower leg. So your physio Ali told me that's the best bone to break, Caroline. Well done. So that was useful to know.
It's easy one to grow back.
And I end up having metalwork put in, but before the operation, I got up to go to the loo in the night and I fell. I was on crutches for the first time and I fell. And oh my goodness, it hurt. And I went to the loo, got back to bed, and I said it was hurting. And I just did this breathing. I just did this breathing. And then as I kind of got calmer, I imagined the pain coming through my leg and out of my foot.
Yeah.
And in 20 minutes, I was asleep.
Oh, brilliant. Yeah. Ooh, I'm going to need to do that breathing to get rid of that image now.
And I use breathing all the time. When I kind of started walking, walking when the plaster came off, every time I put my foot down, I breathed. When I started to walk outside, when I started to walk in the countryside, I'm still doing it now sometimes because it wasn't that long ago. So breathing it sounds ridiculous because we all breathe and then we'll get there. But it's just one of those things that we can learn to do quite quickly and then we can apply at any moment in life to really help us.
Yeah. And I mean, it's one of those things that it sounds woo-woo, but there's actually a really solid research that backs it up. Is there anything else you would like to add? Anything you feel we've left out?
I think there's a few things, as you'd expect from me, Maryke, I'm sorry. But one of them is to keep moving. I hate it when people are told, "Oh, stop moving."
Mm-hmm.
So and then I see people 2 or 3 years down the line who haven't moved, and funny enough, they're in a proper pickle because their body has lost all its condition. And that's people who started off really fit as well. So if you're ever told not to move, always ask how long for.
Yes.
And if you don't get a response, get a second opinion because moving is really important. Pain makes us stop moving, move differently, but moving, continue to move naturally is just so, so important for it. And I think that's a spiral that people unfortunately get into. But I think my general message is that let's not be afraid of the fact that our bodies are perfectly designed to look after us. Our bodies are absolute amazing miracles. There's a reason why we have survived on so many different planets and coped with so many things. We're amazing.
Yeah.
And Pain is part of that system, but likewise, we can use that amazing body and we can use really simple strategies to get you out of pain. Nobody needs to live with pain. Nobody needs to accept pain. Pain can definitely reduce, if not totally go.
That is
Like
brilliant.
sleep all the time.
So how do people get hold of you? Where can they follow you?
Okay, if we've got those kind of questions. So I am on your websites, I believe, Maryke, as a starting point.
Oh, you are? Yes, exactly. So if you go onto either the Treat Maryke Louw's website or the Sports Injury Physio website, and I'll put the links to the websites in the description of the video as well. Caroline's listed under partners. But you've also got your own website where they can find you.
I have my own website. Likewise, I will send you the link for that, Maryke, because we've got an old company name which really isn't helpful, but I'll send you the link for that. But also I'm on Instagram sporadically. I'm sure my last video, I'll be doing it again soon. Again, I'll be doing it soon. So yeah, so some stuff on Instagram. And I'm just what am I on? Injury and Pain Psychology. That's novel.
Okay.
And on LinkedIn, I kind of tend to look more towards organizations for LinkedIn because there's an awful lot organizations can do to help people prevent pain and get over pain as opposed to just sign them off sick. So there's a lot that they can do. So so LinkedIn, I'm just Caroline Marlow, and I think there's something on the line of injury and pain psychology in there as well. But I'll send you all those things.
We'll put all the links in the description.
And all my work is online, so just say you have to be in the UK or Ireland, I'm afraid. But all my work is online, so I'm accessible, and I'm a registered provider with a good number of health insurance companies as well, which might help some people out.
And I mean, if you're watching this and you're not in the UK or Ireland, there will be somebody who does similar work to Caroline in the country you're in. So just search for them and look around and talk to people. It's luckily something that is actually expanding the knowledge about all of this.
Yeah, no, there are certainly. I think one of my kind of things is just make sure that you see somebody who understands pain itself. There's lots of psychologists out there who say that they help people with pain, and I don't doubt that they do. But for me, the magic ingredient is understanding pain in itself. So I think you really need to make sure that whoever you see understands how pain works.
Yeah. Brilliant. Thank you so much, Caroline.
My absolute pleasure. I hope it's been useful, and hopefully people will now see that there's more options for them and there's a positive route out of it.